Interprofessional Clinical Learning Unit, or IPCLU, is a unique learning experience developed on an existing patient care unit. It bridges the perceived gap between academic and clinical roles by having students, faculty, and patient care team members learn and work together, and creates a positive learning and practice environment across the health professions. The core of an IPCLU is a culture of interprofessional care and learning, where communication, interactions, and intentional learning between professions is the norm. Each profession is encouraged to work together interprofessionally instead of side by side, which is multidisciplinary practice. And every healthcare provider on an IPCLU is a practitioner, a learner, and an educator. IPCLU development is a collaborative process involving input and support from both academia and practice. Each IPCLU is developed by the practitioners, educators, and students on the unit. IPCLUs are designed to meet the resources and needs of the unit, so each IPCLU has different tools and features. However, every IPCLU stems from a culture of interprofessional practice and develops their physical tools and resources to support the collaborative culture. On an interprofessional clinical learning unit, professions learn with, from, and about each other to improve collaboration and the quality of care. Interprofessional practice and education are framed around 4 core competencies: communication, collaboration, role clarification, and reflection. Communication contributes to team effectiveness by sharing information, listening and respecting others' opinions, demonstrating flexibility, using a common language, as well as providing and responding to feedback. For example, in current practice, a conversation between 2 professionals might sound like this.
Keep an eye on Mrs. Lee. Her Berg is 20.
The physio wants me to keep an eye on Mrs. Lee because of something he saw. I'm not sure where 20 falls on the scale of Berg scores, but I know it has something to do with the patient falling. I guess I'll have to look this up later, if I can find the time.
In an interprofessional approach, the conversation would sound something like this.
Oh, excellent. Thanks. Hi. I assessed Mrs. Lee and her Berg score was 20, which is low. Her balance is poor and she runs a risk of a fall.
Okay, thanks. Well, then I will make sure that we take fall precautions. I will flag it in the Cardex. Now, any guidance about assistance needed for transfer or activities?
Standby assistance with a transfer belt.
Okay.
Examples of IPCLU tools that support communication include communication boards, an interprofessional Cardex, jargon alert cards, scheduled physician rounds, and IPCLU websites. Collaboration is the process of working with other professions to establish common goals and facilitate shared decision-making, problem-solving, and conflict resolution.
Hi, Mrs. Jones. Could you please tell me about your living arrangements and if you have any bathroom aids?
Like I told the doc yesterday, or whoever he was in the white coat.
You mean the nurse practitioner?
I don't know who, but I told him and another woman in a blue blouse, as well as my nurse this morning. Don't you people talk to one another? I'm supposed to be getting rest, and instead one of you people comes and wakes me up every half an hour to ask the same questions.
These frustrations could be minimized by increasing collaboration amongst the healthcare team. For example,
Okay, let's get started on today's rounds. Looks like a busy day. Mrs. Jones lives at home alone, has home care services coming in twice a day. Up until 3 days ago, she's getting around on her own. How has her mobility been from everybody's standpoint?
Well, I've been helping her shower, and she's a bit wobbly.
We popped in the other day and she said she was too tired to walk. She says she hasn't had any falls before. She just came in because she felt weak. But that's explainable by her pneumonia.
We can fit her for a bath chair or some guide rails.
Good idea.
Hi, Mrs. Jones. My name is Jessica, and I'm your occupational therapist. The team was discussing your care, and it sounds like you're eager to get back home. The doctor says the pneumonia is clearing up nicely, and the nurse says you're feeling stronger. Let's talk about how you get in and out of the bath at home. Do you have any equipment to help you?
I prefer to take a shower, but I'm not sure that I can stand for that long.
We could fit you for a bath chair that you could use.
That sounds great. What do we do?
Well, we would go with you.
IPCLU tools that have been developed to enhance interprofessional collaboration include interprofessional learning rooms for staff and students, interprofessional development and in-services, and shadowing opportunities. Role clarity is important for the functioning of an effective team. The ability to consult, seek advice, and confer with other team members is based on a clear understanding of everyone's capabilities, expertise, and the unit culture. While we are often knowledgeable about the general scope of each other's roles, the specific roles each person plays in certain activities such as fall prevention or swallowing assessments may still be unclear. Current healthcare practice remains siloed as professionals are unable to maximize overlaps in their roles. Utilizing these overlaps makes practice safer and enables increased collaboration. For example, in one setting, not maximizing overlaps may look like this.
Dale Stewart, please return to station 4B. Dale Stewart, please return to station.
My patient is having trouble swallowing. Who should I talk to about that?
You should put it on the doctor's board. It's up to them to handle it.
Mr. Smith has been coughing, so we need to do a chest x-ray, get a speech-language pathologist to do a swallowing assessment. Why wasn't a swallowing assessment done?
The speech-language pathologist was tied up.
I could have done the swallowing assessment. Why didn't they ask me? Are they not considering me an essential service to the team? I heard they were leaning out some teams.
In an interprofessional approach, role clarity and overlap can be used to the team's advantage to provide better, more efficient care.
My patient is having trouble swallowing. Who should I talk to about that?
Great observation. There are several people on this team who can assist with swallowing issues. Our speech-language pathologist, our occupational therapist, and we also have nurses who are specially trained for this. I'm glad I were bringing this up. Let's talk to the team that's rounding right now, and together we can determine who can do the swallowing assessment today.
Mr. Smith is coughing every time he sips water.
Are you available for a swallowing assessment?
I'm all tied up today. How about occupational therapy?
I can do it now. Shall we?
Let's order the patient NPO for now, so he'll have nothing to eat or drink by mouth.
And his oral hygiene is good, so we want to make sure that that's maintained while he's here with us.
Tools such as role clarity posters, role interaction graphics, websites with role descriptions and pictures of unit practitioners and students have been developed to increase role clarity on IPCLUs. Current siloed practice often misses an important aspect of interprofessional teamwork. During a busy clinical day, there may be little time to reflect as a team. However, reflecting on team function and your own professional practice helps the team collaborate on continuous improvements and provide better care. Let's look at how reflection could have assisted Mr. Smith in the previous scene.
Looks like Mr. Smith has developed pneumonia. I appreciate our nursing student bringing the swallow situation to our attention. It's unfortunate the swallowing assessment wasn't done sooner, but the speech-language pathologist was tied up and, well, I didn't know.
I'm sorry I didn't get the assessment done sooner. Does everyone know that the occupational therapist, as well as some of the nurses on our staff, are able to perform swallowing assessments?
The outcome could have changed for Mr. Smith if we had all been aware of each other's roles for swallowing assessments.
I have some project time. I could research everyone's roles around swallowing assessments and see how they overlap in scope and how we could take advantage of that overlap in order to provide better patient care.
I think that would be very helpful.
IPCLUs have developed a reflection blog, feedback forms, and a 360-degree student interprofessional evaluation to support reflection in practice. These are just a few examples of how a unit can improve their interprofessional practice, education, and patient care. On an interprofessional clinical learning unit, each caregiver is skilled in these interprofessional core competencies, and we strive to provide the culture and support to further develop them. Every healthcare provider on an IPCLU is a practitioner, a learner, and an educator. An IPCLU provides an environment that invites inquiry and is driven by team processes and interactions. In the course of becoming an IPCLU, each unit undergoes a process of change and evolution. It is not an instant transformation, but one that continues and evolves over time. For more information about IPCLUs, please visit www.ipclu.ca.